Hello. The partnership among physicians, hospitals, long-term care facilities, and home care providers has to be an unbreakable and cooperative bond in order to ensure positive clinical outcomes and patient family satisfaction. It isn't a mystery to any of us in healthcare that the landscape as well as patient expectations have changed. We cannot work in silos and assume the other providers taking care of our patients. Our challenge will be working together for seamless transitions of care. Together we are better able to coordinate the management of chronic disease and help provide the highest quality care in an environment that is accessible, interconnected, and comfortable to the people we collectively serve. The future holds exciting potential for our community as we join our strengths, skills, and expertise in developing and growing service lines, streamlining operations, developing marketing and planning objectives, and integrating our care management systems. I appreciate the contributions of our physicians who have volunteered their time in leadership roles that have helped shape and inspire us to greater heights. We appreciate the long-term relationships we have with our dedicated active staff of physicians and allied health professionals who are committed to our mission. And I am confident that healthcare east of the river will be preserved because I've witnessed the interest our doctors have in seeking out opportunities to train the next generations of doctors through our partnership with Unicom and our new residency program. The challenge we both have is keeping medicine up to date with our society's changing expectations and values. It will always be a continual struggle. However, you capably meet the challenge by continually expanding your knowledge and improving your skills through continuing medical education and seeking the newest protocols for treatments and your willingness to participate in leadership roles at ECHN. I respect each and every one of you for your commitment to patient care and satisfaction and to the quality and safety of that care. I admire your business savvy in communications, technology, and education. This is what the true nature of a dynamic, progressive, and successful health network holds. On behalf of the hospital staff and the thousands of patients and families we care for each year, I thank you.
This evening, ECHN is pleased to acknowledge in a special way physicians and allied health professionals who have achieved 10 or more years of membership. During the years they joined us, we will share a highlight in the history of medicine. In 2003, the paramyxovirus that causes severe acute respiratory syndrome, otherwise known as SARS, was identified. We would like to acknowledge the following physicians and allied health professionals celebrating 10 years of service. Karen Cadman, Family Medicine. Marion Campbell, Behavioral Health. E.J. Shifulius, Nephrology. Daniel Diver, Cardiology. Thomas Kilkenny, Medical Imaging. Katerina Lucatella, Clinical Psychology. Barbara Pascal Gladstone, Behavioral Health. Candace Pitch, Gastroenterology. Ilona Sternfeld, Ophthalmology. Michael Sternfeld, Otolaryngology. And Lee Tran, Colorectal Surgery. In 1998, the National Cancer Institute reported that the drug tamoxifen reduced the incidence of breast cancer by 45% in high-risk patients. We would like to acknowledge the following physicians and allied health professionals who are celebrating 15 years of service. Saud Anwar, Pulmonary Disease. Stephen Brown, Colorectal Surgery. David Hedberg, Psychiatry. Dalith Cracky, Occupational Medicine. Laura Milliken, Medical Oncology. And Daniel Veltri, Orthopedic Surgery. In 1993, the genetic mutation responsible for hereditary non-polyposis colon cancer was discovered, and a protein responsible for type 1 diabetes mellitus was identified. We would like to acknowledge the following physicians who are celebrating 20 years of service. Michele Conlon, Pathology. Pamela Lewis, Gynecology. Ted Metzger, Medical Imaging. John Schifferdecker, Family Medicine. David Wasserstein, Pulmonary Disease, and Michael Yencho, Pediatrics. In 1988, the New England Journal of Medicine reported that 325 milligrams of aspirin taken every other day significantly reduced the incidence of fatal and non-fatal acute myocardial infarction. We would like to acknowledge the following physicians who are celebrating 25 years of service. Laurie Bain, Dermatology. Hazar Dahan, Cardiology. Edward Densman, Medical Imaging. Raymond Kurker, Family Medicine. Flordeliza Palazzolo, Pediatrics. Robert Parnes, Pediatrics. Girish Sharma, Cardiology. And Daniel Welling, Obstetrics and Gynecology. In 1983, the retrovirus responsible for Acquired Immune Deficiency Syndrome, otherwise known as AIDS, was identified. We would like to acknowledge the following physicians who are celebrating 30 years of service. Lester Kreitzer, Endocrinology. Dennis O'Neill, Pathology. Thomas Staley, Urology. And Marion Stoj, Ophthalmology. In 1978, the last fatal case of smallpox was recorded, the first test tube baby was born, and the first vaccine for bacterial meningitis was developed. We would like to acknowledge the following physicians who are celebrating 35 years of service. Gordon Brodie, Family Medicine. Raymond London, Internal Medicine. Michael Martin, Internal Medicine. Jamie Marvasti, Psychiatry. Nicholas Palermo, Family Medicine. Pedro Romero, Orthopedic Surgery. And Daniel Tardif, Internal Medicine. In 1973, the flexible colonoscope was first used to perform a colonic polypectomy in an effort to reduce the incidence of colon cancer. We are especially pleased to acknowledge the following physician who is celebrating 40 years of service. Barnett Barron, Pediatric Dentistry. Congratulations, Dr. Barron. And congratulations and thanks to all of our milestone honorees for their many years of dedication and service.